As a personal trainer, we encounter clients with special considerations. We know these people as special populations. So one of the conditions that needs consideration is hypertension, also known as high blood pressure. So it's really important when you have a client with high blood pressure, first of all, that obviously when completing the pre-exercise screening questionnaire, that it's identified and a referral is sought from an allied health professional so that they can gain clearance and any recommendations for exercise from their general practitioner. Some of the considerations that can be made are to do with the intensity of the exercise. So it's really important to avoid high intensity exercises, because if you combine a high heart rate with high blood pressure, it can put the client at risk. Also avoiding rapid exercises which gets the client to be moving from a horizontal to a vertical position. This should be avoided as well. I also would be ensuring that there is a longer warm-up and a cool-down period for clients with high blood pressure. And so making sure that first and foremost, that they have clearance from an allied health professional is the most important, and then staying within the limitations and the recommendations from the doctor or allied health professional. Okay, so the second special consideration can be a back injury, which can make it really difficult to train a client. Obviously, it depends on the type of back injury that the client has. That will determine the sort of modifications that need to be made. So speaking with the client, getting information from the client about the type of injury and the limitations as a result of that injury. Again, staying within the recommendations given from an allied health professional is important. It is also important to not completely avoid the area when doing an exercise program, but working with the client and gaining feedback from the client about what they are comfortable with and within the limitations of advice, and basically just ensuring that they are letting you know if they're experiencing any discomfort during the exercises. One exercise that I would avoid with a back injury is a deadlift, because it can put unnecessary stress on the lower back particularly, so that would be one that I would avoid. Okay, another type of special consideration is a shoulder injury. Timothy, who was the client in my simulation, he had a significant surgery to repair a rotator cuff injury over 12 months ago. So talking with him about that injury and the modifications that were necessary. So I mean, he's worked quite hard over the past 12 months to build up strength in that shoulder, so his flexibility and his strength is improving day by day, but getting that feedback from him about what he felt comfortable doing was really important. I again would make sure that the client is very aware of the importance of letting me know of any discomfort that they feel during the exercise, and staying within the recommendations and guidelines from an exercise physiologist or from another allied health professional is really important as well. An exercise that I would avoid with a client like Tim or others with a shoulder injury, again depending on the specifics of the injury, would be a lateral raise for the pressure that it places on the shoulder joint.